Hi, this is Dr. Michael Green, Chief Medical Officer of Winona, and here's 5 things I would never do when prescribing hormone replacement therapy for a patient going through the menopause transition. Number 1, downplay or ignore your symptoms. Never do that. I hear too many stories about patients that are suffering greatly from the menopause transition, and their doctor tells them, oh, just live with it as part of life. No, I'll always take you seriously. Number 2, use synthetic or horse-based medications. At Winona, we only use bioidentical medications. They work better, they're safer, they have less side effects. That's all we'll ever use. Number 3, take risks with your health. My primary responsibility is to keep you safe. If I take care of your hot flashes and make you sick, what good have I done? Never do that. Sometimes that means saying no to things you want. Number 4, practice based on old data. Look, I've been doing this for 23 years. If I'm practicing the same way now as I did when I got out of residency, I'm a bad doctor. I will always keep up on the latest data and practice accordingly. Number 5, overcomplicate treatment. There are too many people out there that make these bizarre complications to practice medical theater. We keep it safe and simple, yet effective.